Good afternoon and welcome into Great Day Washington. I'm Ellen Bryan.
And I'm Kristen Burset-Harris. Thank you for joining us on this beautiful sunny May afternoon. I hope you got outside today.
Yes. Well, in case you didn't know, May is Maternal Mental Health Awareness Month. And as a mom, sometimes you just don't know where to turn. And there are even bigger discrepancies in the Black community, where almost 40% of Black mothers experience maternal mental health conditions.
So today we are raising awareness and telling you that there is help out there. Joining us now with this crucial information is Dr. Darrell Gaskin, Director of the Johns Hopkins Center for Health Disparity Solutions, and Dr. Lauren Parker of the Johns Hopkins Bloomberg School of Public Health. Thank you both for being here.
Thanks for having us.
Thanks for having us.
Dr. Gaskin, I want to start with you. What are some of the factors that contribute to the high rate of maternal morbidity among Black women?
Well, there are two types of factors that are really important. One is that the healthcare system is just not listening to Black women, and it has to do with cultural competency and also implicit bias. And so when women are complaining about things that are happening, that are going wrong with them, the system's not being very responsive to their needs. And then the second has to do with just access to quality health care, in the sense that in some states we haven't expanded Medicaid, and then also the ability to pay providers other than physicians, so doulas and other persons who could support women during the time of pregnancy, because pregnancy is not a disease.
Right.
It's not an illness, and so no one should die from it. But if we do the things that we know we should do, then we can have great outcomes.
Yeah. Dr. Lauren, I know this is very personal for you. You've had your own journey and experience with this. What is your story?
Well, thanks for asking. So it's so interesting because professionally, I study older adults and people with dementia. And so when I got pregnant, I was over 35. So I was the geriatric mom.
Yeah.
And so there are so many precautions when you're over 35 and being a geriatric pregnancy. And so really being active during my pregnancy. And then at the end, I really wanted to have a natural childbirth, no medication. And then my baby was in distress and we didn't know why. So we had to make the decision to have a C-section. And that was something that I really did not want to do because I had done all these practices, all the poses, working with a doula, have a partner. I was ready. I was so mentally prepared. But it was the best decision for me and also for my baby to have a C-section. And that was just something that I wasn't ready for, but it was the best decision. For professionally, it's really important to think about sometimes what you want to do personally might not be, your real birth plan, but it's better for the baby in the long run and also for my health as well. So we did have a positive experience at the end, even though it didn't quite look like what we wanted to.
Yeah.
But not, to your point, like not all moms know that. They don't study it, they don't know it, or if they're going in thinking one thing, if it's completely changed, they're not getting the information that they need. So Dr. Gaskin, what are some immediate actions that healthcare systems can do to help this problem?
So decision support tools and checklists are the enemy of bias. So if you have biases that are affecting your decisions, if healthcare systems would just provide physicians, obstetricians with decision support tools that sort of make sure that they ask certain questions, that they look for certain things, and that they give certain advice, that would be good. And then on the system, at the system level, just again, expanding insurance coverage, providing reimbursement for other persons who are supporting mothers both during the pregnancy and after the pregnancy, so that we have great outcomes.
Dr. Lauren, could anything have improved your experience more for women that you see out there? They're not getting the same kind of care?
I will say that I'm grateful that my doctor listened to me, but when I talk to a lot of moms, especially Black women, they say sometimes the doctor's not listening to them and really valuing their experiences. So I would say that's so important for the healthcare system to value the voices of Black women and all birthing women. And then also really think about the whole team that comes into play. So sometimes it might be mom and dad or partner, but some people might want a doula, as you mentioned, or other advocates there to be a voice when you're in your most vulnerable state and you can't voice your opinion. So those are critical things to really think about and to really ensure that we're providing those types of care.
Yeah. You all have a Hope Challenge initiative coming up this Friday. I guess, Dr. Gaskin, can you explain a little bit what that is?
So Hope Challenge is, there are things that we know to do in order to improve health outcomes for vulnerable populations, for minority populations, that we're just not doing. Meaning everyone, so I mean, we have the greatest healthcare system in the world, but everyone doesn't have access to it. Everyone isn't able to navigate it appropriately. And so what we do is we bring together, in this case, we're bringing together experts, to talk about Black maternal health, Black infant health, the things in which we know that we should be doing, and then try to encourage policymakers and the healthcare delivery system to actually do those things and put those things in place.
It's amazing.
I like in your title, it has solutions, because that's what you've come with today. So thank you so much.
Thank you.
Both
And
of
thank you for sharing your story.
For sharing.
All right, the next Hope Challenge Summit series is the Hands That Rock the Cradle event. It's this Friday, May 24th at the Johns Hopkins Bloomberg Center in DC from 9:30 a.m. to 1:30 p.m.
The event will feature experts in the field and policymakers who are looking to close these gaps in maternal morbidity.